Hello everyone, this is Dr. Scholz from Scholz Chiropractic and Wellness here in Naperville, and today we're going to be talking about the Webster technique for pregnancy. So this is a very common question that we get here, kind of what can we do for pregnancy, what conditions can be treated with it, and what exactly would an appointment look like for that. So the Webster technique is based around the pelvis and the sacrum, which is going to be in the very back of the pelvis here. You have the big SI joints in the back, and then in the front you have your pubic symphysis here. So basically what happens when we walk, and I'm going to show you this from the side, so this would be me here, is the pelvis is going to shift back and forth just like this. Now you can kind of see it again on here. This is a very dramatic version of it, and you can see it from the back view here as well. Same thing, very dramatic version of it, but that's essentially what it looks like when somebody is walking, what the pelvis would look like. Now, typically with pregnancy is that hormone relaxant is going to help just relax everything in the pelvis to allow the baby to expand into that space. So baby's going to keep growing. At the end of the pregnancy, baby's going to drop. And that's typically when women will start to experience that round ligament pain in the front, maybe sometimes sciatica coming down as well from the glutes all the way down the leg. And also a big one is going to be pain in the pubic symphysis. So that's kind of like that groin pain, pubic pain in the front. That's because this joint is going to slowly separate and stretch. Same concept to allow baby to kind of drop in those later stages of pregnancy, and also just for the baby to grow there as well. So the other thing we're going to look at too with the Webster technique is that we're also going to do some ligament releases for mom, and we're also going to do some muscle releases as well. So looking at the spine here, this is going to be the front view. So we have the big hip flexor muscle here. So what we're going to do with the Webster technique is we're going to just release that muscle there to allow those hips to move a little bit better. And then in the back, we're going to release the glutes here as well. So we can kind of see that piriformis, the glutes here, and then that big sciatic nerve is going to run right underneath that, and that's here, and that goes all the way down the leg. So the purpose of the Webster technique for pregnancy is basically just to allow optimal positioning for the baby, basically also to allow for the mother to be in less discomfort during the pregnancy, and just to keep everything moving properly in the pelvis, and hopefully to avoid breach for the baby as well. So hoping that we can kind of stimulate them to kind of move head down at the end of the pregnancy, and just keep mama in a good position there too. So nothing we do in the Webster technique is for the baby. So the entire technique that we use for chiropractic is only treating the mom's body. Nothing is ever interfering with the baby. Another question that we get a lot is Webster technique safe? Yes. Webster technique is actually a very basic sacral and pelvic technique for the mom, and it's going to help a lot with pregnancy, hopefully avoid some of those discomforts, especially in those later stages of pregnancy. So one thing we're going to talk about before we kind of talk about what it would look like is the pregnancy pillows that we use here in the clinic. So we're going to have 2 pillows depending on the stage of pregnancy that mom is in. These pillows are going to be hollow in the middle. So belly is going to go right on top of those pillows to allow the mom to lay face down on the table. Typically when pregnant women come in here, they love being able to lay face down. So they just love using these pillows because it's like the only time during pregnancy that they can actually lay on their belly. So I'm going to kind of demonstrate this on myself so that you can see with just using that smaller pillow there. So we're going to put this one back here. And now, like I said, we can always use 2 just depending on how big the baby is and what stage of pregnancy mom is in at the time. So what's going to happen is that pillow's going to go face down. We're going to lower the table for safety for mom to be going on top of that table. Now, mom is always going to enter on the back of the table here. So basically, we're going to just step up on the table. We can move this pillow around if need be too, for just for comfort. And then the belly is going to go right in the center of that pillow. So belly's going to go straight down here. We're going to kind of move that pillow up, and then this will allow for mom to lay face down, and head is going to go in the same position on the table here. Now what we're going to look at during this technique is that we're going to start with looking at the glutes here. We're going to do those muscle releases on the glutes, check that sacrotuberous ligament, which is right over the back of the glute here as well, to allow the stimulation of the parasympathetic nervous system, which is the rest and digest for mom. which will also get that baby moving there as well. Now, as far as the adjustments go, it is still completely safe to adjust upper mid-back, to adjust the neck, ribs, whatever area really needs it for mom. Sometimes too, mothers can experience that carpal tunnel in the hand just because of some inflammation going on in the arms there, and retention of fluid too. So those are all things that can be addressed on top of the Webster technique there as well. Now, after we're done on the belly, we're going to do a couple drops. We can check that upper back, mid back. Mom is going to step off the table completely. We're going to remove that pillow so she can lay on her back. So mom's going to come back here on the table, lay on her back, and she's going to go face up on the table here. Now, in this position, while she's face up, we're going to check those hip flexors. So leg will come up. We're going to do a little bit of a stretch out to the side after we check to see which one is tight that needs to be released. So we're going to do this here, bring the leg back down. We're also going to check round ligaments here, and we can also check the pubic symphysis as well. So round ligaments are going to be right here. Basically, the release for them is just to hold them in place for about 10-15 seconds in a couple different spots just to release those. That will help release tension in the lower part of the belly. Now, the other thing we can check too in this position is that pubic symphysis, just to make sure that that's moving properly, and we can adjust that for them as well. Now, after we're done checking everything for the belly, we can move back up to the head, check the shoulders here, check the neck. Like I said, those adjustments are still completely safe for mom during pregnancy. Now, one thing I want to mention before I get up off of this table is how you should be getting up out of bed or off of a table during pregnancy. So you don't want to be doing this and spreading the legs apart on the table as you're getting up. Now that's fine when you're not pregnant, but when you're pregnant, you don't want to be doing that because we're separating that pubic symphysis even more. So what we're going to do for this, for mom, is when we start on the back, as we get off the table, you're going to want to shift to the side first here, like this, and we're going to get off the table here and bring those legs around and then come up this way instead. Now, what that does is it keeps the pubic symphysis from stretching even more, especially after an adjustment, because now that we have it moving properly, we don't want to put it right back into that position that it was in before. And then mom can safely just step right off that table there. So if you have any other questions about the Webster technique, always feel free to reach out, but otherwise we hope to see you here soon at Scholz Chiropractic and Wellness, and enjoy the rest of your day.